I am in so much pain. I think I broke something.
12 seconds later.
Hi Stephen, I'm Dr. Patrick. What seems to be the problem today?
I got hit in the abdomen.
What did you get hit by?
The Coke bottle.
How bad's the pain?
Excruciating.
Okay, can you just turn around a bit and just take a look at you? Just around this area here.
Yeah.
It seems like as if we might need to do a procedure that basically minimizes the pain around the celiac plexus area.
Celiac plexus? What's that?
I'll show you.
The celiac plexus is a collection of radiating nerve fibers. This plexus is located posteriorly to the stomach and is in line with the L1 vertebra. This plexus assists with adrenal secretion and intestinal contraction. The sympathetic nerves to the abdominal glands and organs pass through this plexus, and it also consists of two celiac ganglia. These are the largest ganglia in the autonomous nervous system and supply most of the nerves to the digestive tract.
Okay, did you get that?
What's the Albach's and Meissner's plexus? Doris! I got this!
Dramatic reverb.
The Albach and the Meissner plexus are a network of parasympathetic nerves that innervate the gastrointestinal tract, also known together as the myenteric plexus. These two plexuses originate directly from the 10th cranial nerve, the vagus nerve, found in the medulla oblongata, and lines the esophagus, stomach, and the intestines. The Albach plexus is situated between the circular and longitudinal muscle layers of the digestive tract and innervates these muscles to push food down the digestive system, which is also known as peristalsis. The Meissner plexus, on the other hand, sits in the submucous layer between the surface mucous membranes and the muscles. The only known function of the Meissner plexus to date are its aid in digestive fluid secretion and helping with muscle contraction of the digestive tract.
I feel better already! Whoa, that's so awesome! Good morning, class. The cervical plexus innervates the diaphragm, a number of the muscles in the neck, and the skin around the ear and the neck. The nerves of the cervical plexus exit the plexus through the occipital and subclavian triangles, collectively known as the posterior triangle. The cervical plexus is connected to C5 as well as other cranial nerves 10, 11, and 12, which control the heart, other muscles of the neck, and muscles of the tongue. The cervical plexus is a plexus formed by spinal nerves C1 and C4. It's survival!
Are you tired of injuring your brachial plexus? Are those intense days of working out causing you to injure it? Bully's got you stuck between a rock and a hard place.
Centipede.
Make brachial plexus injury a thing of the past with this, the Pit Pad. With our product, you can be sure that the days of injuring your brachial plexus are over. Over years of research, our Gucci scientists have developed and combined new and improved technology to help guard the peripheral nerve network in your axilla, protecting those easy-to-reach nerves which innervate your upper limb. With our advanced technology, we've discovered a way in which to cover up the branches of nerves coming off from the ventral rami of C5 to T1. What? Don't believe me? Take a listen to our Gucci scientist. Well, you see the advanced fabric, they cover up the plexus, which start from the neck and pass over the first rib, easily extend under the clavicle to support and cover up the axilla, ensure that the brachial plexus can still supply movement to the upper limb. The intricate weaving pattern also help cushion the medial and ulnar nerve, your medial lateral forearm flexor. Oh, and we can't forget about the radial nerve that innervate your forearm extensor. This was also done to ensure that you have the maximum comfort as you wear the pit pad. So stop trying to protect yourself the old-fashioned way and get in on the new revolution. Call now and we'll send it to you for only one easy installment of $69.69. Innovate your upper limbs to innervate and protect your brachial plexus today with Pit Pad.
I'm gonna try this today.
Fear not, my child, for I know your pain lies deep within you, within your lumbosacral plexus. The lumbosacral plexus is formed by the interior parts of the lumbar, sacral, and coccygeal nerve, with the 12th thoracic nerve joining the L1 nerve. It's divided into three parts: lumbar, sacral, and the coccygeal plexus. First, we will talk about the lumbar plexus. It is formed by the first 4 lumbar nerves and is also contributed to by the 12th thoracic nerve. These spinal nerves produce 7 nerves from the plexus, which will all contribute to muscle and skin innervation within the abdominal, hip, and leg regions. The T12 to L1 segment of the lumbar plexus will form the iliohypogastric and the ilioguinal nerves. These innervate the transversus abdominis and the abdominal internal oblique muscles. They also form the cutaneous branches, the anterior cutaneous and lateral cutaneous rami, anterior scrotal nerves in males, and the labial nerves in females. The genitofemoral nerve is created by the L1 and L2 segment of the lumbar plexus. It innervates the cremaster males, the muscle of the testes and spermatic cord, as well as the femoral and genital rami. L2 and L3 will form the lateral femoral cutaneous nerve. This innervates the skin on the lateral part of the thigh. L2 to L4 will form the obturator and femoral nerves. These together will innervate the hip adductors, the iliopsoas, sartorius, pectineus, and the quadriceps femoris muscles. They also form the peripatellar plexus, the sphenous nerve, and cutaneous branches down the leg. There are also short, direct muscular branches from this plexus, which innervate the psoas major, quadratus laborum, and the lumbar intertransverse. The sacral fifth and coccygeal nerve form the coccygeal plexus. From this, the anacoccygeal nerve was produced, which innervates skin over the coccyx and the sacrococcygeal joint.
The sacral plexus is formed by spinal nerves L4 to S4. It innervates muscles and skin of the hips, legs, feet, and pelvis. Nerves coming from the vertebrae join together at the greater sciatic foramen to form the flat band, which continues as the sciatic nerve. Other nerves split anteriorly and posteriorly from this band. L4 to S2 supply the superior and inferior gluteal nerves, which innervate the gluteus muscles. These allow for the movement of the thigh and stabilization of the hip joint. S1 to S3 supply the posterior cutaneous femoral nerve, which innervates the skin on the medial side of the legs and also the buttocks. L5 to S2 form the piriformis and obturator internus nerves, which innervate muscles that rotate and stabilize the hip. L4 to S3 form the quadratus femoris nerve, which innervates thigh muscles. These nerves also form the sciatic nerve, which is the largest nerve in the body, which innervates the semitendinous, semimembranous, biceps femoris, and adductor magnus. L4 to S3 form the fibular and tibial nerves, which innervate the muscles and skin of the feet and toes. The pudendal plexus is formed by S2 to S4, and it innervates muscles and skin in the genital area.